Think about this. If you break your arm, an X-ray gives you this really precise, visible answer.
Right, like the doctor can literally just point to a jagged white line on a glowing screen.
Exactly. You get a clear diagnosis right there. But what if your birth control pill is quietly triggering, like a localized mini menopause in your pelvis?
Yeah, that's a completely different story. That is a mystery that millions of people are living with right now, and usually without any diagnosis at all.
Which is wild. And I think we tend to expect birth control to do exactly one job, right? We just assume it operates in this neat, isolated reproductive bubble.
We do, but human biology simply doesn't work in isolated bubbles. I mean, manipulating one hormone is always going to create a ripple effect.
And that brings us to our mission for this deep dive. We are taking a stack of medical guidelines, clinical studies, and real-world user data to answer a highly specific and, frankly, often whispered question.
The big question: can the long-term use of specific progestin-only mini pills create a localized, low-estrogen environment and basically result in chronic vaginal dryness?
Right. So we are going to decode the complex hormone interactions that cause these, surprising side effects.
Yeah, we'll look closely at the cellular level, map out the impact on the localized microbiome, and really break down the mechanisms to explain exactly why this happens to you.
And more importantly, we're going to explore what current clinical guidelines actually say about reversing it, because you do have options.
Absolutely.
But before we get into how a tiny daily pill can cause chronic dryness, we really need to establish what the baseline of a healthy vaginal environment actually looks like.
Right, like who is actually in charge of maintaining that delicate ecosystem every day?
Exactly.
Well, the master architect of the vaginal tissue is estrogen, specifically estradiol.
Okay, estradiol.
Yeah, and we usually think of estrogen purely as a reproductive hormone, something that regulates your menstrual cycle, triggers ovulation, or like prepares the uterus for pregnancy.
Right, the classic reproductive stuff.
Exactly.
Yeah.
But in the lower urogenital tract, its role is fiercely structural.
Structural, meaning it's physically building the tissue itself.
Precisely. The mucous membrane of the vagina is incredibly sensitive to estrogen. So when a person has a sufficient, healthy level of estrogen circulating in their body, it drives robust cell proliferation.
It's basically telling the cells to multiply.
Yeah, it tells the epithelial cells lining the vaginal walls to continuously multiply and mature. And this constant cellular turnover is what keeps the vaginal tissue thick, well supplied with blood flow, and highly elastic.
And the sources mentioned something about vaginal rugae.
Yes, that vital elasticity is maintained by physical structures called vaginal rugae. They are basically accordion-like folds in the tissue.
Like little pleats.
Exactly like pleats. They allow the tissue to stretch and expand without tearing.
Wow, okay. But the sources also mention this really fascinating detail about the process. It isn't just about the physical thickness of the tissue, right?
Right.
This cellular turnover driven by estrogen is essentially like throwing a feast for bacteria.
Oh, absolutely. This is the biological cascade that makes the whole protective ecosystem function.
Walk us through that cascade.
So as estrogen causes those epithelial cells to mature and thicken and move toward the surface, it also causes them to deposit large amounts of glycogen directly inside the cell layers.
And glycogen is just a complex carbohydrate, right?
Yep, exactly. It's a carb. So eventually, the superficial epithelial cells reach the end of their life cycle, and they naturally shed into the vaginal canal.
Okay, they shed.
And when those cells break apart, all that stored glycogen is released into the vaginal fluid.
But it doesn't just sit there in the fluid doing nothing.
No, not at all. It is immediately put to use. Once released, there's an enzyme naturally present in the vaginal fluid called alpha amylase.
Alpha amylase.
Right. And it targets that complex glycogen and breaks it down into smaller, simpler sugars, specifically maltose and maltotriose.
And those simple sugars just happen to be the absolute favorite food of lactobacillus bacteria.
You got it. It's their perfect food source.
So, estrogen is basically acting like a benevolent landlord here. It's keeping the building well heated and maintaining the structural integrity of the walls, that thick elastic tissue with the folds.
I love that analogy. Yeah.
But it is also actively stocking the fridge with groceries, the glycogen, specifically to attract and feed the good tenants, the lactobacilli.
That is exactly what it's doing. And taking that landlord analogy a step further, those good tenants actually pay rent in the form of security and protection.
Oh, how so?
As the lactobacilli feast on those simple sugars, their natural metabolic process produces a crucial byproduct, which is lactic acid.
Okay, lactic acid.
Yeah, and this lactic acid is pumped out into the environment, which drives the vaginal pH down to a highly acidic level,
Mhm.
usually hovering between like 3.5 and 4.5.
Which is pretty acidic, definitely acidic enough to keep unwanted bacteria from moving in.
Exactly. That low pH acts as a formidable natural defense mechanism. It
Mhm.
creates this hostile environment where infection-associated organisms simply cannot survive, let alone multiply.
Yeah. So the landlord provides the physical structure and the carbohydrate food source. The bacterial tenants provide the acidic security system, and the entire ecosystem just remains perfectly balanced.
Perfectly balanced and infection-free.
Okay, so if estrogen is doing all this heavy lifting, building the walls, stocking the fridge, fueling the security system, what exactly is the progestin in the mini pill doing to disrupt this perfectly tuned setup?
Well, to understand the disruption, we really have to look at the unique mechanics of the progestin-only pill, commonly called the POP, and we have to contrast it with standard birth control.
Right, because they work differently.
Very differently. Standard birth control, the combined oral contraceptive, contains both estrogen and a progestin.
So you're getting both.
Right. And because you are taking a steady, relatively high dose of those synthetic hormones every day, it reliably suppresses your brain's communication with your ovaries. It completely and consistently halts ovulation.
But the mini pill is formulated completely differently.
Yeah, the mini pill lacks estrogen entirely. It only contains a small dose of progestin.
Just progestin.
Exactly. And because of this formulation, its primary mechanism of action actually isn't to stop ovulation. The dose isn't always high enough to tell the brain to shut down the ovaries completely.
Really? So what is it doing then?
Its main job is to thicken the cervical mucus. It creates this dense, physical barrier that prevents sperm from ever entering the uterus in the first place.
Wait, okay. If the main job of the mini pill is just thickening cervical mucus, why do so many people taking it stop getting regular periods? Like, are they still ovulating or not?
That is the big question. And the clinical reality of how the mini pill interacts with the ovaries is highly variable.
Variable how?
According to the medical guidelines we reviewed, progestin-only pills only actually suppress ovulation in approximately 50% of cycles.
Wow. Only half the time.
Yeah, because the dose of progestin is so low, your brain and your ovaries are still attempting to communicate. Sometimes, a follicle manages to develop and release an egg.
And other times.
Other times, the progestin suppresses that hormonal signal just enough that the follicle stalls and an egg is not released.
So wait, let me get this straight. If you were taking the exact same pill at the exact same time every single day, your body is essentially flipping a coin every month on whether it is going to ovulate.
That is the biological reality of the medication.
Yeah.
It is a literal 50-50 coin toss for many users.
That is wild.
And in the months where you do ovulate on the mini pill, your ovaries are functioning normally and producing your body's own natural estrogen. The landlord is still stocking the fridge.
Okay, but what about the other months?
In the 50% of cycles where the progestin does successfully inhibit ovulation, your natural estrogen production drops significantly. You enter what endocrinologists call a hypoestrogenic state.
A temporary low estrogen state.
Exactly.
And because many women still ovulate intermittently on this medication, their natural estrogen levels are fluctuating wildly from month to month. One month they have plenty of structural support, and the next month, almost none.
Which brings us to the real physical consequences of that constant hormonal fluctuation. The vaginal tissue requires consistent estrogen to maintain its structure and fetus microbiome.
Right, you can't just starve it half the time.
Exactly. When you subject that tissue to intermittent starvation, the ecosystem begins to collapse.
Let's look at the real-world data on that collapse because this isn't just theoretical physiology. We actually have an incredible data set from a platform called The Lowdown.
Yes, the data there is super revealing.
It is. They collect verified, self-reported reviews from people actually taking these specific medications. And out of 15,502 reviews, specifically for the progestin-only mini pill, a massive 36% reported experiencing vaginal dryness.
36%, over a third of users.
Yeah. And it wasn't just like a mild inconvenience either. Many reported that it impacted their daily lives a great deal or a lot. We are talking about real people here. Like an 18-year-old on the brand slide, or a 31-year-old trying to manage severe PMDD who suddenly find themselves dealing with this deeply uncomfortable, often painful side effect.
And connecting this back to the biological cascade we discussed earlier, the physical fallout experienced by that 36% makes perfect clinical sense.
Because the landlord is gone?
Exactly.
Yeah.
Without a steady, reliable supply of estrogen, The vaginal epithelium begins to thin out. It loses that crucial elasticity we talked about.
And what happens to those folds? The rugae.
The vaginal folds physically start to flatten and disappear.
Yeah.
This makes the tissue pale, extremely fragile, and highly prone to micro tears during intercourse, or even just from inserting a tampon.
Wow. So the landlord literally stopped maintaining the building, and the walls are thinning out.
Furthermore, the landlord stopped stocking the fridge entirely. Because those epithelial cells aren't maturing properly without estrogen, they stop depositing glycogen into their cellular walls.
Oh no, so there's no food.
Right. When those fragile cells shed into the vaginal canal, there is no glycogen for the alpha amylase enzyme to break down. And without those simple sugars, the lactobacilli literally starve to death.
That's horrifying.
It is. And as those good bacteria die off in massive numbers, they stop producing the lactic acid that keeps the environment acidic.
So the security system basically just goes offline and the pH rises.
Exactly. The pH rises above 5, completely moving out of that protective acidic zone. And this upward shift in pH not only causes the chronic dryness, burning irritation, and pain these users are reporting, but it also opens the door for naturally occurring commensal organisms, like E. coli, to suddenly multiply out of control.
Because there's nothing keeping them in check anymore.
Right. The tissue's barrier function weakens entirely, which leaves the user highly susceptible to recurrent urinary tract infections and conditions like bacterial vaginosis.
Okay, so I have to ask, does this mean the synthetic progestin in the mini pill is actively attacking the vaginal tissue to cause this damage? Or is it purely a crime of omission, just the absence of natural estrogen triggering the collapse?
It is largely a crime of omission. The progestin itself isn't, launching a localized toxic attack on the vaginal walls. The thinning, the dryness, and the microbiome starvation are direct results of estrogen deprivation.
It's just the absence of it.
Right. And we can see this mechanism clearly when we contrast the mini pill with other progestin-only contraceptive methods, specifically the injectable contraceptive, DMPA, which is often known by its brand name, Depo-Provera.
Oh, okay. So how is the Depo-Provera injection functionally different from the mini pill? I mean, aren't they both just delivering progestin into the body?
They are, but the dosage and the mechanism of delivery create a drastically different hormonal environment. Studies on human vaginal epithelium show that the DMPA injection delivers a massive dose of progestin.
A much higher dose.
Yes. And it completely and consistently suppresses the brain-ovary connection. There is no intermittent 50-50 coin toss there. It induces a chronic, severe, and relentless estrogen deficit.
Oh, wow.
Furthermore, because the dose is so high, the progestin actually reduces the number of progesterone receptors in the vaginal tissue to nearly undetectable levels. So it further alters how the tissue can even respond to hormones.
So the injection forces a much, much more severe deficit.
Much more severe. Young reproductive age women on the DMPA injection often present in clinics with severe atrophic vaginitis. Their vaginal tissue becomes extremely delicate, pale, and incredibly painful to even touch.
That sounds awful.
It is. The physical presentation is virtually identical to what gynecologists see in postmenopausal women who are not on any hormone replacement therapy.
Wow.
So the mini pill is milder because the estrogen levels fluctuate rather than completely flatline, but the core issue, estrogen deprivation, is the exact same mechanism causing the drought in both cases.
Right. Okay, so if we know the root cause of all this suffering is a localized estrogen deficit, how do we actually fix the underlying issue without forcing someone to abandon their chosen method of birth control?
Because they might really need it.
Exactly. For many people, the mini pill is managing heavy bleeding, endometriosis, or debilitating cramps. So just throwing the pills in the trash really isn't a viable option.
Right, and they shouldn't have to. The clinical guidelines outline a clear, tiered approach to reclaiming the ecosystem. The first line of defense recommended involves non-hormonal treatments, specifically vaginal moisturizers and lubricants.
But there is a significant physiological difference between a moisturizer and a lubricant, right? They aren't the same thing.
Not at all. The lubricants are designed strictly for short-term use, specifically to reduce friction and prevent micro tears during sexual activity. They do not alter the underlying health of the tissue.
And moisturizers.
Moisturizers, on the other hand, are formulated for long-lasting tissue relief. Products containing hyaluronic acid, for example, can be applied to the vaginal canal every few days. The hyaluronic acid binds to water, pulling moisture into the thin tissue to actually relieve the daily ambient symptoms of itching, burning, and dryness.
Okay, but the medical sources noted a very specific and honestly somewhat alarming warning from the World Health Organization about these over-the-counter moisturizers and lubricants.
Yes, the osmolarity warning.
Right. The WHO strictly recommends that products should have an osmolarity of less than 1,200 milliosmoles per kilogram. Why does osmolarity matter so much to this delicate tissue? Like, what does that even mean?
So osmolarity basically refers to the concentration of dissolved particles, like salts, sugars, and preservatives, in a liquid solution. It really comes down to the basic principle of osmosis, where water always wants to move to balance out concentrations.
Okay, I remember osmosis from high school biology.
Exactly. So if you apply a hyperosmolar product to the vagina, meaning a gel that has a massively high concentration of particles, it acts like a chemical sponge.
Oh, yikes.
Yeah. Instead of providing moisture, it will actually pull water out of the already compromised, fragile epithelial cells just to balance itself out.
Wait, so it aggressively dehydrates the exact cells it's supposed to be helping?
Yes, it causes those delicate epithelial cells to physically shrivel, detach, and die.
That's terrible.
It is highly toxic to the tissue and will cause severe irritation, burning, and further damage to the mucosal barrier. That's why checking the osmolarity of a product, or specifically seeking out isoosmolar products that match the body's natural fluid concentration, is so important. It ensures you are hydrating the cells, not destroying them.
Okay, so if non-hormonal moisturizers are carefully selected, they can provide that ambient relief. But what if the tissue is so deprived that moisturizers simply aren't enough to rebuild the walls or feed the microbiome?
Then you need to escalate the treatment. That brings us to localized hormonal treatment.
Right.
If the fundamental root cause is a lack of estrogen, the most direct, scientifically sound solution is to simply replace the missing estrogen locally.
How does someone do that?
This is accomplished using low-dose vaginal estrogen. It's prescribed in the form of specialized creams, tiny vaginal tablets inserted with an applicator, or even a flexible silicone ring that just sits in the vaginal canal.
You know, this concept is brilliant. It functions exactly like installing a highly targeted drip irrigation system for one specific wilting plant, rather than turning on a giant high-pressure sprinkler system and flooding the entire garden.
That is a perfect way to describe it. Because you are applying a microdose of estradiol directly to the vaginal tissue where the specific receptors are located, the systemic absorption is incredibly low.
Meaning the amount of hormone that enters your central bloodstream and circulates through your body.
Exactly. It stays right where you put it. But the local clinical response is profound, rapid, and sustained. Within just a few weeks of use, it forces the epithelial cells to mature and thicken again. It brings back the elasticity and the vaginal rugae. It revascularizes the area by promoting new blood flow.
And most importantly, it forces the cells to start depositing glycogen again.
It restocks the fridge. The glycogen returns, the alpha amylase breaks it down, the lactobacilli population rebounds, and the lactic acid production completely restores the normal acidic pH.
The entire localized menopause is literally reversed.
Reversed completely.
But wait, if a listener goes to their general practitioner or their gynecologist and says, hey, I've been reading about my mini pill and I believe it's giving me localized menopausal dryness, won't the doctor just instruct them to quit taking the birth
A
control?
lot of patients worry about that.
Right. Is local estrogen really prescribed to young, premenopausal, reproductive age women alongside their daily birth control pills? I mean, a lot of doctors seem highly hesitant to mix different hormonal prescriptions.
It is a highly valid concern, and unfortunately, misdiagnosis or outright dismissal does happen frequently in clinical settings because this specific interaction is super under-discussed.
Yeah, that makes sense.
However, if we look strictly at the clinical guidelines, specifically the robust frameworks provided by the British Society of Sexual Medicine, they absolutely and unequivocally support this combined approach.
Oh, wow. So they explicitly endorse treating the side effect while keeping the contraceptive.
They do. The guidelines clearly state that when a patient is using localized vaginal estrogen, there is no need to prescribe additional systemic progesterone to protect the uterine lining from overgrowth.
Because the dose is so small.
Exactly, because the vaginal dose is so remarkably low and localized. It does not interfere with the contraceptive efficacy of the mini pill at all. It is safe, it is highly targeted, and it is a wildly effective treatment for young premenopausal women experiencing these exact debilitating symptoms from their chosen contraceptives.
That is so empowering. It is incredible that resolving such a painful quality of life issue starts with something as simple as recognizing the mechanics of the estrogen deficit.
Knowledge really is power here.
It really is. Whether a patient chooses to manage it non-hormonally by carefully selecting low osmolarity moisturizers or physically rebuilds the ecosystem with targeted local estrogen, there are science-backed, viable solutions that do not require abandoning their birth control.
And the most important takeaway for anyone experiencing these symptoms on a progestin-only contraceptive is clinical validation.
Hmm.
This is a well-documented biological reality.
You aren't imagining it.
No, you're not.
Yeah.
It is a known, measurable physiological response to fluctuating estrogen and glycogen deprivation. You have a literal menu of targeted solutions to bring to your healthcare provider.
You don't have to settle for the mystery, and you certainly don't have to just put up with the discomfort. You know, we've spent this entire time dissecting how manipulating our reproductive hormones to prevent pregnancy inadvertently stars the vital bacteria in our vaginal microbiome. But realizing how directly our hormones control our bacteria raises a wildly provocative question about the future of medicine.
Oh, where are you going with it?
Well, if we know with absolute certainty that estrogen is the master key to feeding the good bacteria and maintaining that protective acidic shield, it really makes you think.
Think about what?
Could the next generation of hormonal birth control be designed not just to prevent pregnancy, but to intentionally engineer, optimize, and feed our microbiomes at the exact same time?
Wow, that is a fascinating thought.
Right. Imagine a daily pill formulated to act as a targeted probiotic trigger, ensuring your localized ecosystem never experiences a drought in the first place, while still providing flawless contraception.
That would be a total game changer for women's health.
It really would. But until that day comes, the muddy waters of your symptoms actually have a clear biological explanation.
The architect can always be restored, and the ecosystem can always be rebuilt.
Thanks for diving deep with us.